My name is Jocelyn Ashford, and I am a member of the VF's Board of Directors. I sit on a committee representing our work in public policy. Now, this is a new committee that was formed this year to help figure out how the VF can support you, the vasculitis community, in navigating and advocating for the best care, as well as perhaps influencing the governmental systems and laws that impact your patient experience. Now, the VF has been involved in public policy for a very long time, but it's done so reactively. We see an opportunity now to think about our involvement a little bit differently. Now, we've had a seat at the table when it comes to public policy for a while, and these seats at the table, or these tables, have a direct impact on the regulations and laws that affect areas of your care, like funding for research, diagnosis, access to doctors, the affordability of your treatments. So we partner with organizations like the Autoimmune Association, the National Organization for Rare Disorders, or NORD, the National Health Council. So while we're at those tables, we want to be able to better represent essentially your voices. We want to be able to express what matters to you, what your pain points are, and we also want to be able to offer up solutions to some of the potential laws and potential other governmental processes that will make your experience better. Now, that probably sounded like I was speaking alien to you. A lot of those words can feel really big and really scary, but one of the things that I will tell you is that while that sounds really big and really scary, why we have a committee in place, is to make this much simpler and make it very directed towards what matters to you. I'm going to keep saying it, what matters to you, because many of you, we're going to turn on commercial mode, many of you may have received a survey, and that survey was about public policy, but it's actually asking you about your journey. What bothers you about your patient experience journey? Is it that your treatments are too expensive? Is it that you can't find a doctor in your area? Is it that it takes too long between the time that you're prescribed a product for you to be able to get it? Is it telehealth, that you want to be able to see your doctors remotely? Whatever it is, we want to know what your challenges are, because we haven't figured out what it is that we're going to advocate for you. We need to know what your problems are. So we encourage you to fill out the survey. You're going to hear me say that a million times. We want you to fill out the survey because we need to know what issues we want to focus on. But I also want to be able to have my colleagues here share a little bit about what that advocating for you could actually look like in real life. So we've got Beth, Kim, and Jane here to provide a little bit of context. Now, as you listen to this context, what you're hearing, again, are examples. They are not necessarily what we are anchored to and supporting you around. We're waiting for your results, but we wanted to make this feel a little bit more tangible. Okay? So to that end, I'm going to turn it over to Beth to talk a little bit more about the history of what the VF has been involved with, as well as present a more recent opportunity that we might have in front of us that you may be interested in. Beth.
Okay. Welcome. I'm the Director of Outreach, and to visualize that, would you please raise your hand? Good, you've all volunteered. That's what outreach does. So I'm here to tell you a little bit about the history of what we've done to date to give a context of where we may go in the future. For a while now, Joyce has been asked to sign on to letters of support for different issues within coalitions, just like Jocelyn said, through NORD, through the Autoimmune Association. One of the more recent ones involved the Orphan Drug Act, which brings drugs to rare disease patients. So we've done that for a while. And then along the way, for instance, NORD, we decided we would become a member because through them, we learned more about the rare disease community and what they were doing. Same thing with the Autoimmune Association, the same thing with the National Health Council. It really aided in our education of what is happening out there. And like Jocelyn said, that's pretty much where we've been involved, with the exception, this past spring, the Autoimmune Association asked us to participate in a fly-in. Does anybody know what a fly-in is? Good, because I didn't know what it was either. But it's a virtual opportunity to meet with legislators and their staff people about an issue. And in this particular case, it was about the Office of Autoimmunity, which was established under the NIH, the director of the NIH. And how that came to be was there's research done in vasculitis, and it kind of cuts across many silos at the NIH, like so many other autoimmune diseases. The problem is different institutions collect data differently and report it out differently. So as a result, it's hard to get a consensus on prevalence, like how many people have vasculitis, where is it happening? And because this impacted other disease states, these coalition of groups lobbied and got them to establish this office. Terrific, terrific. But then I found out this spring that office has no money. So while it was wonderful that this part had been done, we needed to do the next step. And that was one way that the VF could be involved. The thing that I've learned along the way is the vasculitis journey is a very unique journey. There are similarities to other diseases, but there's also a uniqueness about this. And that's why your voice needs to be present, because the things that aren't being addressed need to be addressed. And so the committee made a conscious decision that it begins and ends with the patient voice. And again, I want to reiterate, if you have not taken that survey, please do. We can't tackle every issue all at once, but from what we hear from you, we will begin to prioritize and continue the dialogue with you. So every step of the way, you know what we're doing. And that's where we are as so far.
Thanks, Beth. I want to highlight a couple of things that she shared. One is we're going to talk a lot about your story. We're going to talk a lot about your voice. Throughout any of your involvement, if you think about how you're normally asked to think about vasculitis or how you're normally asked to share about your experience, it's always in someone else's language. It's always trying to think about what matters to your doctor, what matters to, maybe you're on an advisory board for industry and you're providing information around your experience as it relates to a clinical trial. But you're always trying to formulate what your experience looks like in the language of someone else. This is your opportunity to share with us your experience in a raw way, for you to share what no one might ask. And it's very important that we hear that, because that's how we're going to find those little insights that we can then say, here's a problem in the diagnosis, care, and treatment of a vasculitis patient. And to illustrate some of the power of that and why your journey matters, Jane is going to share a little bit about her experience.
Hi, everyone. Again, my name is Jane Ascroft, and I have been helping the VF talk about public policy as part of this committee. And I think they asked me to be here today because I have a professional background in health policy, but I'm mostly here today as a patient. I have GPA, granulomatosis with polyangiitis. So I'm going to talk a little bit about why it's important for patients and organizations to engage in public policy and why they can make a difference. I'm going to start by going way back and tell you just a couple of things about my first foray into health policy, and it was back in the early 1990s. dating myself, I'm in my 50s, okay? I was in grad school at that time, and my first policy job was working on HIV and AIDS policy issues for a National Education Association in DC. Back then, some of you will remember, there were a few HIV treatments available, and the advocacy community was made up predominantly of many HIV-positive people for whom policy changes literally meant life versus death. The work was really intense. It was often frustrating, but it was exciting, and I was hooked, and I've actually worked in public policy and advocacy jobs for my whole career across various organizations. I mentioned that experience because it changed me. It changed me working with those advocates who were affected by the disease that they were engaging in policy on, and it provided important lessons about what patients can accomplish as advocates for change. In the 1980s and 90s, the community of HIV advocates literally altered the health policy landscape. They fought for patients to have a real voice at the table in how their disease was researched and treated. And ultimately, those advocates were pretty successful. There have been a lot of changes made, and while there is no cure for HIV today, patients are living much longer, often with undetectable viral loads. So that community made a huge difference. So fast forward 20 years, from my first policy job. I live in Chicago. I'm working in the health policy unit of a large healthcare association, and I started getting what I called the dizzies. I didn't know how else to describe it. It wasn't quite vertigo, but it was this disabling lightheadedness that I'd never experienced before. And it happened every day. It would start when I was at the office, and it became disabling. Thus began my own diagnostic odyssey, which I'm not going to bore you with because everyone has experienced it. All you patients out there have experienced something similar, months and months of visiting emergency rooms and specialists all over the place trying to figure out what was wrong. Like many of you, by the time I was diagnosed, I was in pretty bad shape. But I continued working because I desperately needed health insurance. Quitting wasn't an option. My husband had passed away a few years prior, and I was basically on my own and getting the health benefits. And while my diagnosis was stressful, you all know it's stressful, what really kept me up at night was worrying about my ability to keep my health insurance. It's a very, very difficult thing for people. It causes us a lot of anxiety, keeping our health insurance, keeping a plan that's going to enable us to get the care that we need. This was 2015, and my rheumatologist had treated GPA. I was diagnosed at a community hospital near my house in Chicagoland, but he didn't treat people very often, and he hadn't infused anybody with rituximab at that point into GPA patients. And he was really concerned, when I was diagnosed, my kidneys were failing. I was on my way to losing my kidneys, and so we needed to start treatment really quickly. And while he knew the literature on rituximab, he was really worried about my insurer approving that drug in time to save my kidneys. So we decided in shared decision-making, my physician, who I loved and I trusted, and I decided that I would start on cyclophosphamide, which is a broad-spectrum drug that many of you have probably taken to try to stabilize my disease. And I bring this up because, in a sense, as I look back on it, this first treatment, this initial treatment decision wasn't fully based on science, right? It was also driven by an insurer policy called prior authorization that delays and denies care for millions of patients every year. Because of my work, I was familiar with prior authorization, and I was familiar with many of the barriers to accessing care, like the high cost of treatments, like the paperwork hassles that we have to go through to get the care that we need. But it's one thing to be aware of those barriers, it's quite another to experience them firsthand. And so I would say that living with this illness has given me new insights that now spill over into my work. And health policy for me and why I volunteered to help out, it's not just what I do for a living, it's personal. Fast forward a couple years after my diagnosis, and I hit an unexpected roadblock trying to access my third round course of rituximab, which I'd been taking for a year as a maintenance medication for my GPA. My local hospital where I was being treated changed hands, and the new corporate owners abruptly shuttered the rheumatology infusion center, and they refused to allow their cancer center to give me the rituximab. The hospital pharmacist actually told the oncologist and the rheumatologist he actually said this, that the hospital wouldn't make any money administering my infusions, and I had to go somewhere else. It was super frustrating. I had health insurance. I have a good health plan. I'm aware of how to navigate the system, and I still ran into a roadblock that shouldn't have been allowed to happen. It was very frustrating, not just for me, but for hundreds of patients whose continuity of care was disrupted by that hospital. Weeks went by. My eyes became inflamed. I started feeling sick, and because I couldn't get my medication on time. I mention this particular roadblock because it really set me back in terms of my health. Eventually, my rheumatologist sent me to an independent infusion center in the area where it took 12 hours to infuse a half dose of rituximab, which the nurses clearly didn't know how to administer. Not only that, but the heat wasn't working in this place. It was February in Chicago, and patients were sitting in the infusion chairs shivering. My sister was there with me, also shivering. 12 hours I was there, and I only got half the dose that I needed. It was uncomfortable, to say the least, and it didn't really feel safe. But honestly, I was too tired to complain. I was worn out just trying to get that half dose that I needed. I dreaded going back to the infusion center, and luckily in July of that year, so like 4 or 5 months later, this is 2017, I attended my first Vasculitis Foundation symposium where I met Dr. Amy Archer, who was setting up a vasculitis center at Northwestern Medicine in Chicago. At that time of that conference, I was really struggling with my GPA, and I only lasted 1 day at the conference. But in that time, I was able to connect with Dr. Archer, and she took me on as a patient. So gratefully, from that point forward, I was able to get the infusions that I needed. But of course, there were other roadblocks and hurdles that I went through, just like you all go through. Roadblocks involving insurance, finding physicians familiar with vasculitis, finding those physicians who are in your health plan's network, finding in-network vasculitis specialists who are accepting new patients, and getting appointments to see those specialists in time to prevent the disease from doing more harm. I don't need to tell you how draining it can be to navigate the health system, especially when you're not feeling well. Yet I'm incredibly fortunate. I have health insurance through my employer. I'm able to continue. I had to take a medical leave when I was pretty sick. I couldn't work, but that was temporary. I'm able to work, and I can literally walk from my office to see my vasculitis specialist. It's that convenient. But I think a lot about patients who don't have meaningful health insurance or who have to travel long distances to see their patients and get their infusions. Managing one's care in the current healthcare system is exhausting, and I think we can all agree that COVID made it even worse. Not only was access to care disrupted by COVID, but what happened to immunocompromised people? We were left behind. This is why, more than ever, we patients need people and organizations influencing public policy on our behalf to help ensure that we have access to healthcare that is affordable, high quality, and timely. We need organizations to fight against insurers' burdensome prior authorization requirements. We need organizations to advocate for policies addressing physician shortages. We have a real problem, rheumatology and some of the other specialists that treat our diseases. They're in short supply. They also suffer burnout. So we need organizations to advocate for policies addressing physician shortages, addressing burnout, so that our specialists don't leave the field and so we don't have to wait so long to get in to see them. We need organizations to push for things like replacement for Evusheld and to advocate for immunocompromised people so we're not left behind again. One of the things that was really upsetting to me as someone who works in health policy was during the pandemic, there were not a lot of people advocating for us, immunocompromised people. And I would say we need organizations to push for research funding into new vasculitis therapies and hopefully one day soon a cure. So this is just a little bit of why public policy matters to me and as a patient, and why I hope it matters to you too. And it's why I'm excited that the Vasculitis Foundation is talking about public policy now and how being more engaged could help us all. Thank you.
Thank you, Jane, for sharing your experience and your story. As you can tell, there are a lot of details in her story that are touched by some type of health policy. Again, that's why we want to know your stories, what's bothered you. I want to transition now to our last speaker and our last example. As we work across public and health policy, we want to be able to amplify our voices at our seat at the table. We're not the biggest community, and we want to make sure that our voices cut through. And so what that means is that there are times that we are going to want, and actually it's most of the time, when we're going to want to find partners who have the same focus and goal in sight. And those could be other patient organizations, those could be professional associations, those could be lawmakers, and they could be industry. And so we have Kim here to share a little bit about what those types of what we call coalitions might look like and what we might be able to accomplish together. Kim?
Thank you. I think I have 2 minutes to summarize 30 years of experience. So first I'll tell you who is Kim Love. So 12 years on Capitol Hill, including leading a health policy team during the drafting of the Affordable Care Act. Several years leading efforts at the National Breast Coalition, where I trained the breast cancer patients to be advocates and find their voice on Capitol Hill. 5 years leading a coalition of patient organizations, universities, and other research orgs fighting in Congress for stem cell research. And then I've been working in industry for the last 10 years as a health policy expert, and I also lobby on Capitol Hill. So I have 1 minute. 3 things that I want you to think about. Number 1, your problems matter. They are valid. Answer that survey, because identifying your problems will give you purpose as an advocate. Number 2, problems need solutions. Sometimes those solutions are policy. In the U.S. healthcare system, every aspect of healthcare is addressed, regulated, determined by policy at some level, your county council, all the way up to the president, and everything in between. And then finally, shared problems and sharing your problems equals power. That's what coalitions are. Coming together and sharing your shared concern, identifying issues for whether it's the president or your county council, making your problem the top of their priority list of things that they have to do. Plain and simple, that's what advocacy is. You're putting your problem at the top of someone's priority list. There are many coalitions that exist in the patient advocacy space and in the health policy space. When you as an organization figure out, okay, this is the policy issue that is going to change the lives of patients with vasculitis, pop up from your VF table and look around, and you will see that there are other groups that have the same problem and want to solve it together with you in coalition. I'll give you just a few examples. There is a coalition to protect Medicare Part D. Many of you receive your healthcare prescription drug benefit through Part D. There's a coalition comprised of over 50 patient organizations. They are called MapRx. They are run by the Lupus Foundation of America. They were instrumental in identifying that there needed to be a cap on out-of-pocket payments for people in Medicare Part D. That was passed into law last year, in part because of patient advocacy, and now they're working, monitoring, watching the implementation of that to make sure it's done in a way that serves patients best. There are coalitions that all hate the step therapy that their patients have to work through to get access to their drugs. There are coalitions that exist to create more funding for the National Institutes of Health, which would include the office that Beth mentioned. There's a coalition that the VF belongs to right now called the National Health Council. It's comprised of over 70 patient organizations, as well as professional societies representing providers, as well as insurers, as well as industry. That organization, I want to leave you with this final thought because I know we have no time. That organization convened a meeting 2 days ago. They're 2 pages back in my notebook here. They had speakers from every major health policy expert and power broker on Capitol Hill. They had the health policy staff of Speaker McCarthy. They had the health policy staff of the Senate Finance Committee, both Republican and Democrat. They had the health policy expert from Senator Schumer, who is the majority leader in the Senate. And they sat at a panel like this, and they looked out at an audience of 70-plus patient and provider organizations. And the first person stood up at the microphone and said, "Here we are as patient groups in coalition. What can we do to get you to listen to us and solve the problems that we all share?" And I'm going to take it back to my first, second, and third point. The answer of every single staffer on that panel was the same. We need to hear your stories. Because in the age of Twitter, in the age of lots of people hollering at each other, in the age of AI, someone's real story, if they take the time to reach out, connect with a staffer, connect even through Zoom and say exactly what you shared, that's what is going to make changes happen. So number one, your problems matter. They will give you your purpose. Number two, problems need solutions, and sometimes it's policy. So take this opportunity seriously, figure out policy. And number three, shared problems, and sharing your problems, which means stories, gives you power to make change. That's it.
Thank you, Kim. So now you've heard a little bit about what we're thinking about with respect to public health policy and the VF. We're interested in hearing from you. We have the survey. I think all of us have mentioned it now. If you are here physically at this meeting, in your packet, there is a little card that has a QR code that will link you directly to that survey. So if you haven't filled it out yet, we encourage you to pull out your phone or your tablet or other device to take some time to fill out that survey. If you are joining us remotely, then you can, that's exactly it. It's a small card. If you are joining us remotely, I encourage you to check your email. If you are on the VF's distribution list, then you would have received this survey via email, so you can check your email, and you should have a link to the survey there as well. We're not going to be taking questions here live, so look for us around the conference. We'll be here. If you want to share your story, ask questions, just reiterate what the problems are that you think we should be addressing through this effort, we'll be here. Find us. And with that, thank you for your time, and we hope you're excited about this work we're embarking upon. Thank you.